Good morning. My name is Francys Crevier. I'm Algonquin and the CEO for the National Council of Urban Indian Health. We are the national representative for urban Indian organizations, also known as UIOs, within the IHS system. On behalf of the 41 UIOs, I would like to thank Chairman Simpson, Ranking Member Pingree, and members of the subcommittee for your leadership to improve health outcomes for Indian country. We know all of you are working hard behind the scenes to help us achieve advanced appropriations for IHS, and thank you for that meaningful step forward. And congratulations to you, Chair Simpson, on your return to this subcommittee. In these 2 days, you will hear from 65 Native leaders that are taking time away from their people to tell you how you can help address the needs of their communities. We know that you can't create solutions to our needs without the support of your colleagues, so we ask that you share our message with those who are not present to ensure that we are heard. Many of you have stood up as champions for us, and we're calling on you to implore your colleagues to join us as we are fighting for our lives. The statistics I'll talk about today should set off alarm bells for policymakers. Our people, your constituents, are dying from very preventable deaths, and we need your help. This Congress has the power to right wrongs of the past and move in the right direction and literally save Native lives. You have the power to fully fund IHS at $51 billion. There are two staggering statistics that keep me up at night. We know that researchers and scientists express grave concern when there is a shift in life expectancy by even 1/10 of a year, and Native life expectancy has not only decreased by 1/10 of a year or even 2/10 of a year, but by almost 7 years. Despite all of the latest technologies and medical advancement, our life expectancy is the same as it was in the US in 1944. We are not living longer and have the worst health disparities in the United States. The past few years have impacted our Native children forever. Over the course of our pandemic, our children lost their caregivers at staggering rates. One of every 168 Native children experienced orphanhood or death of caregivers, meaning Native children were 4.5 times more likely to lose a caregiver. For every one white child caregiver lost, there were almost 5 Native child caregivers lost. That means our children are without their mothers, fathers, aunties, and ultimately the support that is central to thriving communities. Our suicide rate has also increased 26% from 2018 to 2021, and we are the highest in the nation at 33%. Our Indian health providers are doing everything they can to lift up children and families, but we need full funding to help solve this crisis. I know many of your colleagues in Congress believe IHS already gets enough. Yet increases in funding of similar agencies often outpace those of IHS, and IHS has never been properly funded. The increases provided by this committee, very much appreciated, are frankly not nearly enough. Gruesome statistics I cited are a result of incremental increases to a historically and chronically underfunded budget that aren't nearly enough to begin addressing these jarring disparities. We constantly hear blame for IHS, but how can you blame an agency that was not set up for success, funded at less than 10% of need? For over 50 years, without advanced appropriations, mandatory or full funding, our providers have been operating without a full budget or budget certainty. Why would anyone ask Indian health providers to operate knowing they will not be able to pay their doctors on time because of late payments due to DC politics? How do you expect IHS to really address these awful statistics? How can they continue to be hubs for innovative solutions for our communities? The answer is full funding. IHS has never been able to operate to their fullest capacity because they only have 10% of what they need. Although our providers are great stewards of the funds they can access, it is not enough to care for our communities in the ways that we deserve. A fundamental shift must occur so we can begin to address the issues I bring to you today. Decades of IHS being underfunded has led to the worst health disparities in most of Indian country. Yes, we are resilient, but that does not mean that the government can allow Indian health to remain underfunded. Native people deserve full, healthy lives, and we cannot continue to rely on short-term solutions that can only address symptoms of a problem. So we ask for full funding for IHS and the Urban Indian Health line item. Make advanced appropriations and 100% FMAP for UIOs permanent. Protect us from sequestration. And you've heard from our Seattle UIO on the last panel on how the investments from Congress can expand services tremendously. So you have the power to steer this ship and stand on the right side of history. Together we can get it right this time. Thank you.
Thank you. William.